and welcome to the David Tomsic Show, fighting tyranny one day at a time. The United States healthcare system is literally in an iron lung, is on life support, and it's collapsing fast. Now, you'd think living in the world's richest country, the most wealthy country on earth, would have premium healthcare for everyone. I mean, this is America, right? But not so fast there, Professor. We don't. Now, some light was shed on this, sadly, in December of 2024 when one of the executives from United Healthcare, the CEO actually, Brian Thomas, was murdered by a guy named Luigi Mangione. Now, I hate to say this, but millions of people cheered this. Now, United Healthcare is crummy. It has a lot of bad press. It has some of the highest denial rates of any company that basically provides healthcare insurance. And this was a debate that went on throughout the country for quite a while. But I wanted to premise this whole healthcare debate with how things can get out of hand, how the perception of impropriety can be a really, really bad thing for America. So in recent comparison, and it says for the top 10 wealthy industrialized nations, the United States healthcare system ranked last overall, despite spending the most on healthcare. This is according to a Commonwealth Fund report. Now, what I found out is that Americans spend collectively $4 trillion on healthcare. But sadly, as many as 550,000 people a year file for medical bankruptcy in America. What's interesting is that a little over 90% of Americans have health care coverage, and yet still people are filing for medical bankruptcy in America. Now, I keep saying in America because, once again, there's a tale of two Americas. Now, if you've watched my videos, you realize that I'm not going easy on the current administration, because I look at the supporters of this administration and I look at what they really want, what they're hoping to get out of Donald Trump. And it's stuff like this. You see, we're dividing the country into those who can grab it all and those who have to end up filing for bankruptcy because they had a medical bill they couldn't afford to pay. That's the tale of two Americas. Now, basically, over 50 million people are covered by the American Care Act, which is also known as Obamacare. This is a much maligned legislation. And, of course, most Republicans and conservatives hate this. Now, let me be honest with you. Once again, to use reason, it wasn't great legislation. It wasn't well thought out. But when you rush something through and you want to get coverage to people, this is sometimes what you get. The thing is, a lot of people were helped by this, were covered by this. You see, in the ends do justify the means when it comes to saving lives and helping people. But we have so many today that just worry about the money. They're money people. And I said yesterday on a video, those are the worst. They'll talk money to you. Born again, Bible-believing Christians, they're there and God's saving me. And then they talk about the money. We don't want to help those people because it costs the money. Why don't they pull themselves up by their bootstraps? We're not going to help them. This is the contradiction that we see today. So once you get by the horrible health insurance companies, the co-pays, the deductibles, and all this stuff, you find yourself in a quagmire. Try to find health insurance on any website. You're inundated with pretty much, you're going to be paying a lot of money one way or the other. It's like a casino. The house never loses. Healthcare companies will never lose. Everybody backs them. All of our congressmen do. The presidents do. Everybody does that has maybe some skin in the game that are getting that big money. But those people that are told they have cancer and they have to go get treatment, they're the ones getting screwed here. Meanwhile, the executives make more and more. Yet I digress. Let me give you a little example just of two health insurance companies I looked at. Signa, their denial rate. That means, okay, if you ask for a claim for whatever it is, their rate of saying no to you is about 14 to 20%. So up to 20% of the time, you may say, you're not going to get that help. You're on your own. Try a witch doctor. United Healthcare, back to this Brian Thompson, these type of people, they had a 33% denial rate. In fact, doctors said that this is run by an artificial intelligence, and it's a model they use. And I'm told by some programmers I know that it has a error rate of about 90%. But when doctors type it in, they get an answer quick, and it's usually no within 5 seconds. And within 5 seconds, you know whether you're going to die or whether you're going to live. Isn't that nice of your health care insurance provider? Isn't it? The results of this gives us the attitude that money is where it all is, that it isn't about saving lives. It isn't about finding new medicines and helping people to get what they need in treatments. No, it's about making money, whether you die or not. If they can't make money off you, you're dead. This is the reality, and this is what made this controversy over the Brian Thompson murder so interesting, is that the Fox News people said, people are so upset with this guy, he was murdered. Yet, how many people have people like Brian Thompson, how many executives have let people die across this nation? How many have suffered? How many have lost their homes, have had to file bankruptcy? How many? A lot. Obviously, bankruptcy is an average of $550,000 a year. So don't tell me who to feel sorry for, Fox Fascist News Network. So this is the wealthiest country in the world. And we allow these middlemen, these executives, the executives of these healthcare companies to make billions in profits. They make 10, 20, 30, $40 million a year to deny you getting the help you need. That's what they do, because it's always about profits. Remember, the house never loses. Well, somebody loses, and it's the average American who needs to be treated, who needs to find an answer to their condition, and they refuse to help because it isn't about helping you. It's about making money. Just like the President of the United States, Elon Musk, and that whole group of people that run this country, the elites. It's all about money. But the last 10 years, profits by insurance companies have doubled, tripled, and quadrupled. No one seems to think. Like I said, CEOs are making tens and 20 and $30 million a year. But there's always money to put in the pockets, into the election pockets of politicians, of presidents. That's why you'll never see true reform, because they don't want to spend money. They want to make money. So why don't we just give them the money? We don't take care of anybody. If that's what they really want, we'll eliminate the true middleman, the person who's sick. Don't treat them. Don't allow them to go to the doctor. And guess what? That's coming to a doctor's office near you, people. That's right. Soon you're not even going to be able to see a doctor. That's how drastically this country might change and will change under Donald Trump. Now, as far as the rest of the world's concerned, medical bankruptcy is not a big issue. It hardly ever happens. America is far and above the number one place in the world that has medical bankruptcies because people can't afford to care here. Now, Trump and his 2025, I know you've heard of Project 2025, right? Right? You have. Well, that's a product of a think tank, right-wing think tanks, a lot of them, mainly the Heritage Foundation and their president, Kevin Roberts. These people, if it's up to them, you won't have anything. You won't have anything. They want to change it all. Well, I've got a little article here, and I'm going to pull this article up, my friends. Here it is. Led by the Heritage Foundation, there's a 922-page collection of policy proposals that Donald Trump's going to march through in his second term. Now, the blueprint calls for a massive overhaul of the federal government. We see it, including health reforms that would deregulate health care. You don't want that. Weaken the ACA, which is the Obamacare, defund and privatize federal safety net programs, and allow discrimination within and beyond healthcare settings. The playbook is built on numerous falsehoods about government, including how Medicare and Medicaid work, how federal laws preempts conflicting state laws, and how the law interacts with healthcare more broadly. Although many of the proposals are unlawful, this will not be a likely deterrent for a second Trump administration. One main goal of Project 2025 is to return to the untenable pre-ACA status. That's pre-Obamacare status. The playbook details plans to achieve Republicans' year-long goal to repeal the ACA, which would limit or remove health care insurance coverage for millions of people and replace with the insurance plans that lack many of the ACA's signature protections, such as requiring coverage for essential health benefits, prohibiting exclusion on pre-existing conditions, and reducing prescription drug costs. Consequently, low-income people predictably would become uninsured, meaning they wait longer to receive care or seek none. Their health deteriorates and thus becomes harder and more expensive to treat. They cannot afford necessary health care, and any costs accrued are passed on to the insured patients through higher premiums. This is what you have in store for you. Now, for those of you that have money and have good health care, and if you have a deductible, you can afford to pay it. If you have co-pays, you can afford to pay it. God bless you. Consider yourself fortunate. Many, many, many millions of Americans do not. In fact, my story is I have a dry eye condition. I have contacts. I had to use Restasis. It's prescribed to me by my doctor. It was $54 for one basically box of Restasis. It lasted me 3 months. I went back just yesterday, and guess what the cost was? $596. $596. A friend of mine who is receiving cancer treatments needed blood thinners. He paid $53 in 2024. He went, and now it's $144 for 1 month. If he wants it for the full 90 days, it's near $500. Now, I'm not blaming anybody for this because, frankly, no one seems to care anyway except the people that got to pay for it. The reality here is, and this is my commentary, the reality here is the problem is that we have a disconnect in America. As I mentioned in so many videos, we have a large population that seems to think it's okay to dislike everybody, to not offer any help to anybody that isn't them, to not offer safety nets for the poor or the disenfranchised. What we want to do in this country right now is shut everything off, make it exclusively for a certain classification of people. Everybody else need not apply. We've purposely, or I should say the Trump administration, has purposely made half of America believe that somehow by cutting all these costs is going to make America great again. Listen, I'm going to do a couple more videos coming up. One's going to be on the full ramifications of Project 2025, and the other is going to be on balancing the budget. How it's not what you think, which isn't going to happen anyway, but this push to make all these cuts will only damage America. Of course, with Project 2025 and healthcare, it will only damage America more. It will hurt those that need help the most. What's America if it can't help its own people? People complain about immigrants. The same people that complain about immigrants, that complain about every other class of people, still won't even help the people that are in their country, won't help American citizens. They'll lock them out too because they don't matter. What matters is this pie-in-the-sky bunch of bullshit that Donald Trump throws at people to make everybody think that he's going to solve the problems and everybody else is the problem except him. Well, guess what, Donald? For those of us in growing numbers who know that you're a liar, the problem is you. And I call upon Congress to finally make a stand and stand for health care for everybody, good health care for everybody in this country. There's no reason we can't do it. Don't give so much money to the Defense Department to make bombs and kill people and drone people. Help our citizens now. Well, it's all the time I have. God bless you. Listen, I'm going to promote Nights Around the Fire again, my sister channel with Ashley Hamilton. Go to that channel, watch that video, share that video. We'll subscribe to that. We're going to be doing more videos very soon. I'll put the link to that YouTube channel in the description box today. Anyway, God bless you, and I'll see you next time right here on The David Tomsic Show.